and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Malaysia's Ministry of Health has set a very ambitious target to fully digitalize all public hospitals by the end of 2028, with a long-term goal of one person, one record, which is a single interoperable digital health record for every Malaysian. Now, joining us on the show today to tell us more about this vision, I have Dr Mahesh Appannan, who is the Director of the Digital Health Division of Ministry of Health Malaysia, which is a division that was set up in March of last year. Dr Mahesh, thank you so much for being on the show with me today.
Thank you.
I am very interested to learn more about this overarching vision of digital health for Malaysia, specifically the one person, one record initiative. I think Dr Zul has talked about that quite a lot, this idea of a single unified health record for every person. Talk to me about what it aims to solve, because I want to know, maybe as a patient, what that patient experience would look like if this initiative is fully realized.
Right. Thanks for having me here, Melissa. When we talk about one person, one record, as it says, that we want to have all our patients, all persons, to have their health information at their fingertips. Today, as we speak, when a patient moves from one healthcare facility to another, nothing is carried with them. And lots of time taken to elicit history, getting all those patient information and whatnot. How now if the record follows the patient to another facility? So that says it all. One person, one record. Okay,
so because currently they don't, right? So every time somebody moves from one clinic kesihatan to another public hospital, for instance, they don't have the information, the tests that were done, the diagnosis, all of that has to be redone.
Correct. You have to redo back everything back again.
Okay. Are we also talking about private, public, or is it just focusing just on public healthcare first?
Ultimately, it's going to be private, public as well. So we want to treat the person, the patient as a whole. He might be visiting the private healthcare facility, or from private healthcare facility, he will be coming up to the government healthcare facility. How these records follow them. So eventually, we want all to be interoperable.
That is the vision.
Yes.
That is the vision. Where are we now?
Right.
Where are we currently at?
Okay, so let's just talk about the public healthcare system. We have got close to about 150 hospitals. 22 of them are now having some sort of software, an electronic medical record, and all those are just digitized. And moving to public healthcare clinics, less than 0.1% of them are actually digital.
Oh, less than 0?
Less than 0.1%, because we have got close to about 3,000 clinics available,
okay.
And 107 was previously digital, and now we are accelerating, trying to get all of them, the basic fundamental electronic medical records in place.
Okay. Do you think you can hit the target of all being digitalized by 2028?
Yes, I think it's important for us to have a vision.
Okay.
And what we are looking at right now is trying to get all our primary healthcare clinics, including rural healthcare clinics and community healthcare clinics, have electronic medical records by the end of 2026.
Okay. Talk to me about what building blocks are needed to achieve that. So the ambition is there. You're right, let's work towards something, but what are the building blocks that are needed to get there? Talk us through the thinking, or essentially this is your division's job, right? This is the raison d'etre for your division. Yeah. Talk to us about that.
Yeah, I think we've got an overarching objective to be very person-centric and for us to have a very sustainable digital health ecosystem. It's so important sometimes when we design systems, when we deploy systems, we fail to look at the most important puzzle, which is the person himself, our clients, our patients. Yeah. How do we now have them within the entire planning of the ecosystem? I think that's something very, very important. Until and unless we don't have them within the loop, we cannot close the loop. I think that's something very, very important.
So talk to me a little bit about that. What was it before if it wasn't person-centric?
Okay, our previous thinking is that we need to have person's record when I see a patient. Now we want to empower every individual to also take charge of their health information. every information of the patient should be at their fingertips. I think that's the ultimate goal. That's what one person, one record means.
Okay, so where are we in terms of those building blocks? So you talked about how there's this vision and you gave us a current analysis of where we're at right now. How do we move forward? How do we accelerate this?
Right. So one of it, we've got 3 different interventions here. The first thing is, how do we now leverage on our existing digital health infrastructure? We've started basically having digital systems in MOH since 1985.
Oh, okay.
So it's now many, many years. And how do we've invested quite a bit, how do we leverage on all those existing good functioning digital health infrastructure? That's the first thing. How do we now structure them, standardize them, and make use of all those health information, and we want to start pushing all those information to individuals. I think that's one thing that we have done. And of course now one of the digital infrastructure, or we call it a digital public infrastructure that's available in Malaysia, is MySejahtera. We've got huge adoption, we've got many people with that particular app. How do we make that as the digital health front door? Now what we need to do is try to push all those records to individuals. And we've achieved something really, really interesting in the past 1 year. We've made use of our existing softwares, and we've already gotten prescription records to close to about 6.5 million people. If you have updated your MySejahtera, you've now gotten
What does
your
that mean?
prescription
What does that mean
records.
that how many millions of people have this already?
So if any of these people have visited any of our public government clinics or hospitals, their prescription records will be at their fingertips. So you can access your prescription records, what medication that you have been discharged with. Those were the days where doctors would spend close to about 10 minutes eliciting history. What medication are you on if you're a hypertensive? But now, with all those at their palm, they can always share it with their doctor.
Okay, so that's the kind of pharmacy side, right? How do you link all the other current systems? So you say they're good systems, but they're all operating independently of each other. And when sometimes we talk about interoperability as the kind of holy grail of any system.
Correct. I think that is so important. That's paramount. So one important work that we do is to ensure standardization. When you ensure standardization, then things can be interoperable. Like, speaking the same language in tech world. Right now, that is the thing that we did, and we not only managed to push prescription records. If any one of you who have visited any of our dental healthcare facility, your dental health record would be with you already. So we have close to about 1.5 million individuals who visited our dental health clinics, have got their encounter summary with you right now.
That's amazing. So we've got pharmacy, we've got dental. What's the next step?
We've got screening records. We've screened close to about 3 over million people. All those screening information is with individuals. And of course, now we're looking at all your health clinic visits, your hospital visits. All those summaries should be with the patient.
Is that harder to implement?
Definitely, because we're looking at all those old systems that we've been using did not follow standards. So we've got to standardize them, then start moving. So we do not want to just wait until we get things perfect. Whatever that we've done, we launch first. Whatever that we've already successfully standardized them, we will start pushing it to patients.
So one of the things that strike me is that in the 1.5 years that this division has been up and running, you've gotten a lot of things done, and it's almost like quick rollout. Let's just figure this as we go. Has that been the ethos?
Definitely, because we cannot waste any more time with what vision of not our health minister, but also the Honourable Prime Minister and all other ministries going digital. We need to ensure that we work really, really fast, because we want good patient outcomes. At the end of the day, we are catering for the people of Malaysia, people living in Malaysia. How do we have that? We need to start thinking very innovatively.
Okay. Often when change comes very fast, it meets resistance. And that happens in every organization. So have you encountered any resistance to this change that you've been pushing?
Definitely, but we are pretty lucky. We are pretty lucky in the sense that all doctors, all healthcare workers want things to be easier. You know, managing just way too many patients nowadays, we need some sort of softwares to augment our daily work process. But being healthcare professionals, we want everything perfect. We want everything perfect. And for us to ensure that we push in a system, a software, a solution, we need to gain trust first.
Yep.
So our change management mantra is you see, you feel, then you change. So we start deploying systems, showing them the benefit of that particular system. That's when they start moving towards, all right, let's have this in my facilities.
Can you give me an example? Have you seen that actually change somebody's opinion or somebody's approach to?
Of course. I mean, the entire philosophy of digitalization before this was building our own system.
Yeah.
Way back in 2023, it all started in 2023, where you know, the island of Tioman, we have got one huge clinic with 4 different rural clinics. How did we actually connect them? Because they were all renovated, but the doctors were still using pen and paper. So at that point of time, management thought that, no, this cannot be the way, let's go do away with papers. That's when we resorted to this new concept, business model of not deploying something that we built, something a little bit more mature, subscribing to off-the-shelf electronic medical record system. And we deployed it in just less than a week. All 5 digital, and you don't need patients to take their boat, speedboat, to come to the main clinic. They can speak online and all their records are connected.
The time frame boggles my mind that you can deploy this within a week. Is that typical, or was this, is this something you intend, this kind of this timeline of talking about weeks? And sometimes people talk about projects for years, months and years. This is in a matter of weeks that you've managed to do this. Is that typical? Is there an urgent? I feel the urgency behind it.
So basically, it's an innovative way of deploying systems. Deployment is a science by itself. How my team figured out the best deployment method. Of course, it involves multiple different stakeholders. And if you plan it really well, and by having all those basic fundamental infrastructure in place, your connectivity in place, your hardware is in place, deploying a system would be as easy as...
So you work out the steps and then you just put it into place.
Correct.
That cuts the time frame.
Correct.
So short.
Now you have social media, you have videos where doctors can watch, you know. Everyone is tech savvy these days. How do we utilize all those talent, all those champions who can drive this real quick? Okay,
so I think previously there was news that you had very quickly ramped up Malaysia's first cloud-based clinics. I think it was the first 50, and then the ball just got rolling from there. Where are we now, and at what point did you start to see that really snowball, that momentum grow?
You said it real right. How did that snowball? It all started when we were given the mandate after Tioman. Oh, it's working really well, so let's do more. So at that point of time, we had limited budget. So we opened up to all my colleagues on the ground, all those clinics, which had ready connectivity and also hardware. And we deployed the system in 50 clinics in just under 8 weeks. And that was a turning point, and it was possible to be done. And today they're all enjoying, you know, we managed to cut down waiting time, patient waiting time to under 30 minutes for almost 70% of our patients.
Wow.
Yeah.
That's just through having this digitalization in the clinics.
Correct. I think one important thing for us to note is the difference between digitizing something and digitalizing something.
So we had this conversation before where I think, and many people as well, we interchange this word, not knowing the difference. Maybe you might want to explain this in the context of public healthcare.
Right. So when you digitize something, you're basically, you know, having all those what you write in the paper to the computer. But when you digitalize something, you're actually understanding the entire business process, the patient flow in the clinic, understanding all those different pain points and trying to automate them. So for example, you know, searching for patient record cards and sorting them into different consultation rooms. The machine can actually do it. So you cut short the time of segregating them and just putting them into different rooms. So things like that is so easy to be done when you use a system.
Are the challenges all the same across the board, or are there unique circumstances that are particular to a certain setting, a certain clinic, a certain public hospital?
So a very, very good question, Melissa. We need to understand one thing. We believe in standardization. Okay. How different can one clinic be in Kuala Lumpur to another clinic in Ipoh? We need to standardize even patient workflow process. Patient should have the same experience when he goes from one healthcare facility to another. It is also important for us as healthcare workers. I need not give him a long, 1 week long duration of orientation, getting to know my clinic and whatnot, because everything is standard, it's the same workflow process.
Wow. Okay. So this is interesting to have standardization across the board, but also understanding the entire process, the digitalization process. I'm curious to know more about the shift in the thinking. So you talked to me a little bit earlier about how the Ministry of Health had for years built its own systems, good systems, but very siloed and each not interoperable, right? Talk to me about shifting to a subscription-based model and what prompted this change in philosophy.
Right. So when you build something, you have to have that expertise. And electronic medical records is a market-driven industry. It's a specialty by itself. It's a software, a branch of technology, health technology by itself.
Because other countries use it, right?
Yes, yes. And if you want to follow the trend of fast-moving tech era, you need to have that team who can work like how to quickly deploy and scale systems. We don't have that. I always remind ourselves that our focus is very different. In the Ministry of Health, we govern the healthcare system and we provide healthcare service delivery. We are not system developers. So we'll leave them to the experts out there. And now, when we subscribe, we will be assured that we have the best system in the market, which moves in as time goes, which have all sorts of advancements inbuilt. So we do not have to every single new technology which is available, we tend to try to figure it out ourselves.
Why didn't we adopt this approach previously?
At that point of time, our school of thought was different. Data security is something that to be always being looked onto, privacy. But now all systems that's available are by design secured and private and confidential. Okay. And you get the best of the best when we start using those.
So would the concerns over say sovereignty of these systems, right? Because I can imagine that the traditional government procurement methods would be thinking about how do we safeguard our technology, our data, our systems. There's sovereignty to owning it.
Yeah.
Now in this subscription-based era, I mean, we all subscribe to things personally and in the workplace. There is a question also of what happens to that system that are we outsourcing? Are there questions about accountability, questions about quality, for instance? And you talked about standardization a bit earlier. Yeah. How do we ensure that all of that comes into play?
That goes by design. Even before we get all those systems, we have to make sure that all the guardrails are in place.
But you're buying off the shelf, right?
Correct. So you need to ensure that you have these specifications for you to adhere to. For example, all our data, all our health information should be sovereign and resident. So storage of information, we have to follow our guidelines. Our government has come up with beautiful guidelines for us to adhere to. So whatever software that we subscribe, they have to adhere to our rules and regulations. They have to be in Malaysia. The data center should be in Malaysia. It has to be, within our reach. It has to satisfy various different security protocols and things like that.
Okay, so you are at the very start saying these are our requirements. This is what we need. You design it as such.
By design, because we cannot compromise on security. So that is already there from the start.
Okay. Once this is all in place, talk to me a little bit about the digital health front door as a way to kind of access all healthcare in Malaysia. Paint a picture of what it could be like and what needs to happen next for it to happen.
Right. I mean, today in this age and this era, you order food via Grab.
Yeah.
You book your hotels through technology. And why can't we do it in the healthcare sector? Right? I think people are hungry for a front door, for digital health. Today, if I would want to make an appointment to see a doctor, see a dentist, I can do it at my convenience at any point of time. And that is the meaning of digital front door. Not only that, having my healthcare information at my fingertips, I think that's superbly important. And in this highly globalized era, people travel everywhere. How now, if I visit Brazil or America or India, how can I now, if I fall sick or would want to get second opinion, how can I share my information with healthcare practitioners not in Malaysia?
You're thinking beyond even domestically interoperable, but internationally interoperable.
Correct. We cannot just be locally interoperable, we must be globally interoperable now.
Okay. Are you concerned that all this, the kind of rush and the urgency to digitalize, we might leave some people behind? I'm thinking of older folks, I'm thinking of people from rural communities, underprivileged, who might not have this tech savviness that you desire Malaysians to have.
Right. I love this question, and we get this a lot actually. We need to understand that digital equity is important. While we have that in mind, we cannot miss out on the bigger opportunity. I always follow the 80-20 rule. 80% of the people actually are already having some sort of digital tools with them. But leaving no one behind, I think that's very, very important. For example, how do I now take care of my elderly? For example, if you still remember during COVID, we've got managed dependence where your child can actually manage your parents and things like that.
That's right. Booking vaccine appointments for them.
Correct. For people who are not digitally savvy. Not only that, do not forget the less privileged, people who are blind and things like that. So we are engaging with all those societies, making tech really accessible. And things move really fast. How do you build applications which are low tech? I think that's something very important for us to consider as well. And people who are not reachable. Recently, I don't know whether you've heard about this, we recently had a collaborative effort with the Ministry of Communications, MCMC, on how we now utilize their NADI centers which are located at communities which we cannot reach. How do we now utilize telemedicine technology for us to speak to them? So technology is there, it's just a matter of how do we want to use it to the benefit of those people.
That was a great bit of intergovernment cooperation.
Oh, yeah.
We rarely see ministries working together on that level, but that was a really wonderful bit of collaboration.
I think it's really, really important, and it was shown during COVID how multi-agency cooperation really works. And now it's on to us. How are we collaborating with the Finance Ministry, Ministry of Economy, Ministry of Digital, and everyone else to make this a success?
Since you brought up COVID and MySejahtera, I do have to ask you, after the controversies around MySejahtera, how do you feel the need that you have to rebuild trust amongst Malaysians in terms of the handling of health data, in terms of digital tools and all of that?
Definitely. Digital trust is very important. So everyone is moving towards being digital. How do we now gain trust? I think having all those safeguards, following protocols is so important, and we need to continuously educate people. If you can have your data secured in the financial industry, why not the health industry?
Yeah, we always forget how quickly we've adopted online banking. Okay, so if we were to, say, years from now, look back at our efforts to push digitalization in healthcare, I'm just wondering what you would have hoped we achieve through this technology. And I'm asking what your philosophy of care is in the digital age, because there will be trade-offs made, right, in terms of this push to digitalization. How do you think about that as someone who's steeped in public health, steeped in thinking about the whole experience of healthcare? How do you see that if you were to look back years from now and you think, oh, these were the principles and values that guided our journey?
Yeah, definitely. I think we have to be very technical in our minds, but human at heart. I think that's what I would say. As being a doctor myself, how I have all these values inbuilt while we design systems.
Yeah.
Be very technical in our minds, but human at heart. That would I would say.
Because there is a human element of care,
Definitely.
Despite the digitalization.
Definitely,
of healthcare.
definitely.
Yeah. I'm very excited for this vision that you've painted for us, and I look forward to the day where I have my healthcare records at my fingertips. So thank you so much for being on the show with me. I appreciate your time.
Thank you very much for having me.
That's all the time we have for you on this episode of Consider This. I'm Melisa Idris signing off for the evening. Thank you so much for watching.